Senator Ted Kennedy died late last night of brain cancer. With me now is ISU Professor Alok Bhushan from the Biomedical and Pharmaceutical Sciences field. Professor, thanks for joining us. Before we get into explaining what this was...
Thank you for inviting me.
You bet. That Ted Kennedy suffered from for a little over a year. Tell us why this is your specialty. What have you done in this field?
I've been working on this for the last 16 years. And what I'm doing is we are looking at new agents to block invasion of these brain tumors into normal tissue.
Now, let's
because what happens is this tumor
Go ahead.
is actually, you can take it out surgically, but it invades into normal tissue and it can become lethal.
Now, what exactly was the form of brain cancer that Senator Kennedy had? I understand it was a glioma. Can you explain what that is?
Glioblastoma is the glioma or malignant glioma. That is the kind of cancer he had. It is a brain tumor, and 50% of all brain tumors are glioblastomas. And it arises from the glial cells, and that is why it is called glioblastoma.
Anything peculiar about this that he had? The form that he had was, is it a common? Is it very aggressive? Treatable? We understand he was going under treatments.
It is very aggressive, and usually the patients do not survive more than 2 years. I would say 15 months to 18 months, or yeah. So it is a very bad tumor.
So the treatments really don't extend survival rates that much.
They extend, but not to a great extent. And these days they use a drug called Temodor, and also they use Avastin. Avastin is a drug that blocks the blood supply into the tumors and tries to shrink the tumor. So these are some of the treatments that are used currently.
Okay. We want to help out our viewers here and take action for them, because explain to us, is there any light at the end of the tunnel that you see in your research in beating this?
Well, we have found a natural compound which actually blocks invasion of these gliomas. So what we are trying to do is we are trying to attach it with a molecule that drags it into the brain, because brain is protected by a barrier, and that barrier stops from drugs to get into the cells, into the brain. So our goal is to make compounds that can go into the brain and treat this tumor.
Professor, best of luck, and we hope that you succeed in your research. Thanks for joining us.
Thank you. Thank you for it.